Hello everyone, my name is Muhammad. I'm a dental hygienist from Tashkent. Today we are with Professor of Periodontology, Giulio Rasperini. I'm very glad to see you in Tashkent again. Thank you for your course. It's very interesting. It's a huge honor to participate in your course and hands-on. Can you tell the key points of your lecture to those who couldn't come here?
Thank you. This is the second time I'm coming to Uzbekistan. The first time I gave a comprehensive course on periodontology treatment. This time the topic is about the advanced surgical technique for surgery specific indications like papillar reconstruction and things like that. Let's say it's periodontal regeneration in general. But the main focus is about preserving the natural dentition as much as possible. And the key point at the end is to have patients that know how to brush, to keep inflammation away. So we need to teach to our patients how they should brush, and ourselves, we should help them to keep the inflammation away from the mouth.
So, by the way, can you explain the key points of preventive periodontal care?
That's really, it's not only periodontology, all dentistry. The aim of a dentist, of a physician, is to keep the patients healthy. So, if you want to keep your patient healthy, it's very easy. You need to teach to your patients from the very beginning how to brush. Some people don't brush. Some people brush, but brush in a wrong way, too aggressive, and create a gingival recession. So there are specific tools, specific ways. So once the patient brush properly and go regularly to the hygienist, this patient will give very little money to the dentist because he will keep his teeth healthy, the gums healthy, no cavities, no periodontal disease. The only thing he may need is maybe orthodontic treatment, but it's the only thing.
Can you explain the role of dental hygienists and how can dental hygienists can collaborate with dentists?
I always say in my lectures that we should have more dental hygienists than dentists. If you want to have a healthy population, if I become like the Ministry of Health in Italy, I will ask to have more hygienists than dentists. Because dentists, when they don't know what to do, they extract teeth. Teeth, if someone doesn't extract, stays in the mouth. Now there is a tool that are dental implants. Dental implants is a great innovation. They works well if used properly. But nowadays, there are too many dentists that extract a lot of teeth that don't need to be extracted because patients believes that to have an implant is better and cooler than to have a natural teeth. But of course, it's not true. It's a prosthesis, like prosthesis of your knee or any type of prosthesis of your body. It's better to have your own body working properly. So the main focus is to save the natural dentition. So the hygienist is very important because he needs to teach to the patient not only how to keep clean, but also the lifestyle. Quit smoking, because smoke is not good. If they have diabetes, to go under diet and to recommend to a professional guy that can follow them, a diabetologist, and in this way we keep the population healthy because the mouth, the oral cavity is linked to the rest of the body. If you have inflammation in your mouth, this inflammation is bothering other part of the body.
Good. So how about implants? What risk factors do we have in dental implants? where nowadays it's very popular in our city.
So the implants are a fantastic tool. If someone have a car accident and lose the tooth and have a trauma, then we will need to regenerate the bone, the soft tissues, and we can place implants. When a tooth is definitely lost, we can remove and place an implant. But we should not remove healthy teeth or teeth that doesn't need to be extracted just because we want to place implant, because it's simpler, faster, and dentists can make more money. And people, we take advantage of the fact that the population thinks that it's a great tool and it's cool to have implants. But honestly, it's not. I don't have implants in my mouth. I don't have even crowns. Just keeping clean and go to regular visits, I can preserve my dentition healthy. And this is what I wish for my patients.
So how about development of periodontology and preventive care in those countries where the preventive periodontal care is well experienced? What advantages do they have comparing to other countries?
The preventive care is very important. Of course, the modern periodontology is with the 5P. We should predict. Now, genetically, we can predict when the periodontal disease will occur, even in a little child. In this way, we can personalize, we can prevent, so predict, personalize, prevent, and make the patient to participate to the treatment. The patient should know what is the disease. We need to explain what is the disease, what are the reasons, and in this way he can help himself to become healthy.
Nice. What challenges do the dentists or hygienists face while maintaining oral health and in periodontal patients?
The problem again is the motivation of the patient, because a good hygienist is not an hygienist that clean well the gums and the teeth. Of course, this is important, but the most important is to engage the patient, to explain and to make the patient understand and to cooperate, because it's more important that the patient brush properly at home than the work of the hygienist. So, because this is a home care that should be done every day. Some people erroneously think that I put dental implants, so I will have not the disease. You have the same disease that you have around the teeth, except for caries. But of course, you can have a periimplantitis. Inflammation around the teeth is even worse because it's more difficult to treat and less predictable. And so it's actually the patient pays money, and the aesthetic result rarely is satisfactory. In the congresses, we see the good, cool cases, but there are few. Most of the time, I see crowns or dental implants. They are not very good looking, honestly. And so natural dentition is much better. And so for hygienists, it's important to spend the time and talk and listen to the patient, and have the patient to put in a way the conversation that is the patient asking you, what should I do to be healthy? You know, we should address questions to the patient and to make him she should be like we are talking now. We should do the same with our patients every time. Because we need to listen them, and we need to help them to be healthy.
So what tips and tricks can you give us to motivate our patients? Something.
But I think it's very. Is your personality. You need to really need to be important for you, the fact that there are no bacteria, for you and all the team. For example, if you tell to the patient, oh, you should quit smoking, and then you go outside and you smoke a cigarette, or you go, that's not good. You should be the first one that doesn't smoke, and you should believe that this is wrong because you read, you study, and you know that this is really wrong. And because of the vessels, diabetes and smoke have the same issue. We have papillas between the teeth that are very thin, and the blood vessels are very small. And smoke and diabetes, they influence the little vessels. So you don't have these little vessels, so you lose your papilla, you lose the interdental tissue, and in the periphery of our body, we have less blood. That is the problem with the diabetes, and is the problem also with the smoking. So that's why you need to behave yourself, and it is about a personality, not how good looking is the hygienist, but how to listen and to understand the psychology of the patient and try to engage his need and to enter in it and give time for that. Not just 1 hour, boom, 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 clean, if you do faster, and then I see another patient. No, each patient is important. He need to feel important. He need to feel listened, and then we can change his mentality. And once you do that, you do forever.
Thank you. And a question about how do you see the future of periodontology?
Oh, it's fantastic. The future of periodontology is fantastic because honestly, I don't think that if I have a daughter and she's a young dentist, when she got married, she will have kids probably. I think her kids probably they will not see implants, or very rarely, because nowadays it's easy to save the teeth. We just need to focus on it and to make the people conscious of that. The population should be informed about that.
And last question, what tips and tricks and advices can you give to dental hygienists or to those who take their first steps in periodontology?
Oh, that's just love your job, because it's a beautiful job. Do with passion. When you enter in the office, switch off the phone and don't look at Instagram all the time. Just enjoy what you're doing and concentrate on your own patients and listen to them. And each patient is a special person. The patients trust you. They come to you. And so you need to feel honored of that. Even, sometimes they say, oh, there is a good patient, but all the patients are good. Even the one that takes a little bit our patients away, we need to consider that each patient is a good patient, and we just need to give 100% to each of them from 8 o'clock in the morning until 7 p.m. at night. At least at 7, I finish to work.
Thank you, Professor.
Thank you.
Thank you very much.
Thank you.